This is Dr. Prashant with another video on skincare. When you look at the skin, you can often imagine it to be very similar to a foam mattress in that it has got a fabric on top and a foamy structure underneath the fabric. The fabric in our skin is called the epidermis, and it does what the fabric of a foam mattress does, which is protect our skin from environmental damage and UV damage. The dermis or the foam component does a similar job to a foam mattress. It gives our skin the plumpness, and it does this by the presence of collagen, elastin, and sugars which hold water. And all of these molecules are made by a cell that is called a fibroblast. Once you are 30, the fibroblast generally stops producing the collagen and elastin, and therefore you end up with a fixed amount of collagen and elastin in your skin, which deteriorates with age, with ultraviolet exposure, which is sun exposure, and with the effects of hormonal changes, to a point where the fabric becomes uneven in texture. This is to do with some areas being extra thick and some areas being very smooth. So you get these complexion which is rough in parts and smooth in other parts. The other things that can happen with the fabric is that you can get pigment problems or sunspots or solar lentigines, or you can get joining up of the freckles that you used to have as a young person. Besides the fabric, the changes that happen in the foam or the dermis give rise to the wrinkling. The loss of collagen, the loss of the sugars which hold the water, mean that the skin loses its plumpness and starts wrinkling or holding expression wrinkles for much longer than it used to when you were younger. The answer to how to remedy this is the use of some kind of a vitamin A cream or serum. And we have three different molecules over here. This one is tretinoin, which is by far the best and most well documented molecule of vitamin A. It is a bit more irritant than the others, but when you know how to use it, it can give you the changes the fastest. The next molecule is adapalene. It comes as a gel and it is less irritant. It gets absorbed faster than the tretinoin and therefore needs less contact time. So patients find it more doable compared to the tretinoin. And finally, for patients who need a skin transformation and have extremely sensitive skin, you use a retinol. This serum by IS has got 1% retinol and is formulated in such a way that it can actually cause cellular change, an improvement in the texture, the tone, the fine wrinkles, and the pigment without causing much irritation. How we use these molecules and in combination with what other creams and applications we'll discuss in the next video. Thanks for the listening. See you next time.